No, thank you. I'm really delighted and actually honored to be here with you this afternoon on the hottest day in Atlanta history. I mean, you couldn't make this up, right? Okay. So, yeah, just a couple of things to add to my bio that I didn't throw in. My wife and I are therapists in Atlanta, and I'm one of these guys who, now probably no other guys in this room are this way, but I was a therapist, but I was like a big runner and all this kind of thing. And my wife one day decided it'd be a good idea for us to start learning yoga. And I was like, yeah, honey, you go ahead and let me know how that works out. And she kept on, kept on about it. And so finally, to silence her a little bit, I went along with it. And I was like, the worst possible yoga student. And I'll tell you why. It wasn't too much the skill part, but it was the attitude. You see, being a male, I just thought I had to really force myself to do all these things. And for me, I really had to learn that it was like letting go into it, letting go, and creating a sense of calm. Well, this kept on with my wife, and that wasn't good enough that we did yoga classes. Well, she wanted us to teach the things now, right? Ever heard this sort of story before? So this goes on, and long story short, it ends up that, some years later, I end up going through the training and really, honestly, genuinely enjoying it, really enjoying it. And now, in our practice, we really integrate it with a lot of other things. Like, in other words, as a counselor, talking is good. You unload your problems, you get different perspectives, very, very good. But we also have to get into the wisdom of the body. The body is always sending us signals and talking to us at all times. Now, speaking of talking, I thought this was kind of funny. The audio guy in the back, he says, be sure that you talk loud enough. And I told him, I said, I'm from a large family, so I don't think that'll be a problem. Well, to be specific, I'm the oldest of 10 kids. The oldest of 10 kids. I always told my parents they had 9 kids too many. I mean, what is it with these people and these kids, right? So, but along the way, I really had to step in, you can imagine, as the oldest. And, of course, always went into rescuer professions, EMT. I did all kind of things, okay? And so because it was a good family, but because it wasn't actually the Brady Bunch and the Huxtables, I learned to, develop some various different skills. And so it's interesting, in my original family, there isn't scapulohumeral disease. What it is something called, and that's FSH for short, right? Isn't that convenient that they do that, FSH for short? In mine, it's HHT. So we would say HHT, and people, of course, would look at you probably the same way as when you say FSH, right? Cross-eyed. And that actually is Hereditary Hemorrhagic Telangiectasia, Weber syndrome. Kind of another one of these really long words. And what does that actually mean? It's a rare blood disease with bleeding, nosebleeds, and so forth. And I'm telling you all this to say that, along the way, we've had struggles. I don't have FSH, but I do have some other things, celiac and other things that I've been challenged with personally in my life. A lot of my family members have MS, pretty serious epilepsy and issues like this. So I know just, from that, personal standpoint of getting in there where the rubber meets the road. This isn't something that, you do out of a book. Also in my work, my wife and I both do contractual work with cancer wellness at Piedmont Hospital here in Atlanta. So we work with a lot of cancer patients and a lot of caregivers. Can I just see a show of hands of how many would consider themselves caregivers in here? Okay. What we say with cancer is that with respect to the caregiver, it's equal. It's equal. So in other words, all of our programs at Cancer Wellness are open to everybody because the impact is the same. Yes, the cancer patient actually has the cancer, but the difficulty and the challenge of the caregiver often with respect to feelings of helplessness You're not helpless, actually, but the feeling, gosh, I want to do more, and so forth and so on, can really be challenging. So these are all important points that came to mind when I was asked to speak to you, and I'm really excited about it because some of the things that I want to be able to plug in are things that I think are realistic. Now, not everybody can do everything that I'm going to propose, but here's what I'm hoping, really. I'm hoping that out of what I'm going to set forth this afternoon, that there's maybe one or two things that you take away that will give you more of an anti-disease environment in your body. That's, and if that works, great. That's wonderful. Now, with respect to our book, let me just say something on this real quick. My wife and I would love to sell millions of books. But the truth is, we have had 3 or 4 stories that have touched us very deeply about what it actually meant to someone. Meaning like to someone who was in hospice, for example. I mean, these are the things that really touch us deeply. And so what I'm trying to say is when we're in the healing profession, it's very gratifying when I know or I'm told, gosh, that really made a difference. And I got to be honest with you, sometimes I'm shocked. I want to go, really? People have walked up to, oh my gosh, this did this or that. I wouldn't have bet on it. I really wouldn't have bet on it. But yet, hearing these things is really pleasant. And think about for you, when you're able to help someone or help yourself in a positive way, it does feel good. And by the way, if we could galvanize the human spirit in this room, it would be staggering. I mean, it would be staggering the effect that it could have on a lot of healing outside of this room. I mean, this is a lot of positive energy. And with respect to what you may have been through, I'm not going to act like I know what you've been through. I'm just going to say, though, that the fact that you're here and you're facing something that's really difficult, and you're not giving up. I mean, this really means a lot. In all of my research and in all of the doctors I've talked to of many diseases, cancer, diabetes, heart disease, you name it, the human spirit, the human will and the desire to live and to grow makes a lot of difference. It does so at a chemical level in your brain. When you see it and you believe it, things start to shift. So I just want to, again, compliment you and commend you just for your, I just say, indomitable spirit. And anyway, so when I'm saying mindful, I'm going to say mindful yoga, relaxation, and other integrative practices. Why am I saying integrative? Integrative practices is we're going to take the traditional approaches that we don't want to discard, and we're going to put together the complementary practices like mindfulness meditation, yoga, acupuncture, so forth and so on, and we're going to marry those together, and that's why we call it integrative. And this idea is that the human being is not just a set of chemicals, are we? How could we be? We're more than a set of chemicals. Well, we have electricity in our brain, for example. We have energy coursing through our bodies. And so it's just to mention that, how can we segment that the brain is up here and it's got nothing to do with anything else? In fact, you know that there are as many neuroreceptors around your heart and your gut as there are in your brain. Meaning that we have a mobile brain. When I talked about the wisdom of the body, we're going to listen to what's going on in the body because a lot of times it knows what's best for us, doesn't it? It'll give us hints and things to think about. So we just don't want to discard that. So the mobile brain, the ability of the body to also tell us different things about what we can do. By the way, we can influence our body and even what's going on with us. Now, I'm going to use a word here, and it's not a test, it's just an idea. Has anybody heard of the word epigenetic? Has anybody heard that word epigenetic? Okay. All that's simply meaning is control above genetics. Now, hear what I'm saying. It doesn't mean that you're going to change your genetics. But what it's meaning is you're going to influence the expression of it. You're going to have some kind of influence on what is going on with you. Now, for me, I better face the fact that I'm not going to be 6'3". I'm just not going to be 6'3". Much, I still hope for that. I really, short people like me, it's always 5'8.5". We always say the half. But, still hoping for the 6'3" type thing. But my wife tells me, honey, you need to face it. You would need a new set of parents. So I guess it's probably not going to happen this round. But the idea is I can't do anything about that, but I can manage my 5.5 frame in some form or fashion. So there's similarly, with respect to what the situation is with you very individually and very personally, I just want to ask you to look at what is actually possible for you. So when I'm talking about mindful yoga, by the way, I'm talking about, it's like, why is it mindful yoga? Why is it not mindless yoga? Or why isn't some other kind of yoga? Well, it's actually that you're bringing your attention into the present moment. Like, in other words, right now, as I'm sitting here looking at you, for example, I'm not thinking of what I'm going to eat tonight. I'm not thinking, did I pay that bill? I'm not thinking, gosh, when I was coming here, somebody almost ran me off. In other words, I'm in the present moment. And as we practice various yogic practices based on your level of ability and condition, we're going to continue to come into the present moment. Now, why would we do that? Because it's thought that the present moment is the only true reality. Okay? It doesn't mean you don't plan, but the future is actually an illusion. It's not here right now, is it? And the past is a non-reality in the sense that it only exists in memory. Now, we want to keep the good memories and ponder them, don't get me wrong. But a lot of times we spend so much of our lives focused on things in the past. God, I should have, could have done this. Or anxiety and fear about what can happen, that the precious present moment in front of us we're not seeing. And this is a really important point, is that our minds, which are good, our minds are good, being able to work with our minds to really create, as I said earlier, a state of anti-disease within the body is not only possible, but it's very likely. So I'm going to show you just a few things. When we're talking about yoga and breath work, I just want to tell you, why would you want to do such a thing? Why would you try? I'm going to have a demo later, and I'm going to just have a couple of people in chairs and just show you what you can do in even a chair. So you don't have to, this isn't about putting your ankle behind your head. I can't put my ankle behind my head. But the idea of what are the benefits? So let's look. It's going to beef up the immune system. The T cells are going to come up, reduces cortisol and other stress hormones. You always hear about cortisol. They have the commercials on TV. Eat this, take that, lower the cortisol. Reduces fatigue. So what I'm asking you to do is you're looking at these benefits like, would this help me with respect to what I'm going through? Alleviates anxiety and depression symptoms. Ever been through that in your journey? Eases nausea and relieves discomfort, assists in modulating pain by increasing endorphins. Now, let me tell you about endorphins. This is really important. If you've ever had along your journey anywhere in your life with respect to this illness or with something else to have to take morphine or Demerol or Dilaudid, these kind of drugs, they're pretty strong, right? They're pretty powerful. The human body has a drug called endorphin that is 10 times stronger than those drugs. The word, why do they say the word endorphin? Endorphin is actually two words. It's endogenous morphine. Endogenous morphine, meaning that within our brains, we have the ability through shifts in our mind, our breathing, our movement, etc., to actually create a very relaxed anti-pain feeling in the body. So let's talk about endorphins. This is what it's going to boost. Helps the circulatory, muscular, digestive, nervous system function more effectively. That might be pretty good, right? So with that one, again, you do have to look at where you are. I have to meet you where you are, but you have to meet yourself where you are actually. We say that yoga is for everyone. I was doing it literally, I'm not making this up, with my 3-year-old godson this morning he's doing all kind of antics with it. But I've done it with my mother, who was much, much older, a lot older, in fact, who was 80 before she passed. And so it's just, again, the idea that when you look at yourself and you say, okay, this is what this guy is talking about, I think this part maybe could help me. Maybe I could try a little bit of this. It might be worth it. Decreases hot flashes. My wife makes sure that I put that one in there. Decreases insomnia symptoms. Improves the lymphatic system. So we're going to get the lymph system moving through various things. And you'll see how simple these movements are. I mean, again, it's no complicated thing. You got to go, get in this class and do all these things for 90 minutes to gain benefits. Strengthens the body and improves balance and flexibility. So we know with this illness, sometimes the imbalance of the system. So it really is interesting to think about that when we work with yoga with respect to other kinds of physical illnesses, the body's wisdom again starts to come out so that you have a little bit better sense of balance and that you're a little bit stronger. That's fair for us to expect. And in other words, that's fair for me to predict or say, you probably would have a little better balance. You'd probably feel stronger. You'd probably feel a little bit better. You have less pain if you have pain. Calms the mind and body, inducing deep relaxation. Most people that don't have illnesses, because I've been a counselor 30 years. Those people that don't have any illnesses. Honestly, y'all, sometimes my wife and I have clients who are like, we're in worse shape than they are. Some people really don't have that many problems. But it's just to say that even people that are not struggling, financially or with physical things, etc., they seek calm. Of course we seek calm. So this is a benefit that can come along with mindful yoga. And although that's going to be the focus of the demonstration, there are tons of other ideas that we actually could be using, like mindfulness. I mentioned this, and that's what our book is based on, the whole idea of coming into the present moment. Well, look at these benefits. Enhances immune system, reduces inflammation. Okay, inflammation is a precursor to disease. It has something to do with the disease process. So as we have an instrument or a way or a tool to reduce inflammation in the body responds to that. Does it mean that the body's cured? No, that's not what I'm saying. But as we reduce that, we start to feel better because that goes down and there's not this antagonistic relationship going on in the body. Assist with pain management, reduce depression and anxiety, enhances the healing process. So people who meditate, by the way, you think I'm kidding, but I was, by the way, the worst meditator in the world. You know what I mean? Like, I closed my eyes and I was like, okay, I think I could do this for about 20 seconds. But what happens, if you practice it long enough, you get these benefits. I mean, your brain literally starts to shift. There's a physical shift in the brain. But also, meditators heal at 4 times the rate of people who don't meditate. So with cuts or bruises or other issues. So again, this is information to think about. Regulates blood pressure. So if it's high, it lowers it. If it's low, it gets it to where it's supposed to be. Regulates sleep, calms the central nervous. Again, calm, okay? Now, here's one that you may not have been expecting, okay? Why should FSH patients or their families or anyone else laugh? Is this guy crazy? Is he blind? That he would say this? And by the way, I do humor workshops with cancer patients, and I'll have people, I mean, non-cancer people off the street, you know, so to speak, or friends, are you crazy? Don't you understand these people have cancer? Well, yeah, but they have a sense of humor too, right? So here's what I want you to think about. When you laugh really hard, okay, regardless of what you're struggling with, I want you to just think right now of somebody who really makes you laugh. Somebody that when you, like I can think of two people right this instant. My wife, who is hilarious, and a really good friend, Scott. It's really funny. In fact, if I think of Scott, I won't be able to finish the presentation. But he's that type person that you'll be laughing so hard that you're bent over laughing, right? And you're really, you can't see these people after you've eaten a meal because it's going to come out, you know, just, wow, you're laughing so hard. Your stomach's squeezing, your heart. But then here's the thing, and this proves endorphins, by the way, because within a few minutes you do this thing like you laugh and everything, and then you go, right? That's endorphins working in your body. And what is it? It feels bad, doesn't it? No, it feels pretty good, right? It coats the body with a sense of well-being, and you feel better. So are you now cured? Do you now feel, you know, or is everything all better? Is this a panacea? No, but it's an important ingredient. And sometimes because we can take whatever our situation is so seriously that we forget about our sense of humor. I have people come to my workshop and they're like, yeah, I don't have a sense of humor. Listen, by the time the thing's over, I mean, they're the ones that are really funny, and they've really underestimated their ability to laugh at things. So again, if you just, in your mind, thought of somebody or a situation, it could have even been on this journey, something that was so outrageous that you laughed at it. And you smiled. There's going to be a slight chemical shift as a result of that. Maybe inside you're like, you started your stomach going a little bit, you know. Well, that's even better, okay? So I want to encourage you with respect to, you know, this tool that is very important as well. Flexibility in the joints and muscles. I mean, you can imagine that. My gosh, I mean, you're huffing and puffing and, you know, the chest and squeezing the stomach and all of that stuff. So you know that's got to be happening. The T cells, you know, when you laugh, you bend over. Generally, you lean forward. I mean, some people, you go back too. But what's going on is the thymus gland, which I better not touch this again, up here at the top of the breastbone is part of the source of T cells, the white blood cell family. So that when you that's a great way to activate that. So in a very real, direct way, as you laugh, you initiate more of the healing effect within the body. Better mood and disposition, and that makes sense, doesn't it? I mean, you just feel better, like something was really bothering you, somebody made you laugh, and then you're just a tad lighter. Massages all the organs in the body. Circulation for most diseases is an issue. So as you allow yourself to laugh, then you have a little bit better circulation moving through the body. Now, massage, we're not going to do massage today, and I'm not really qualified to do that. I work with people that do that. But why would you utilize massage? And first of all, you probably need to go, I would really ask a licensed therapist, if you haven't already been, to give you an idea of whether they're actually able to work with you or not, or what the limits are. Like some would say, well, I need, you know, a doctor's note, or no, I've never worked with you, but we could try it. And you're like, I don't know, let me look for somebody that's more specialized. But again, you're going to have the reduction in pain, the decrease in nausea, the improvement in circulation, fatigue goes away some, the decreases in anxiety. So are you starting to see a thread to all of this? All of these different practices have these core, we'd say like these core benefits that we go through with it. And so I want to go over some self-care techniques that we can do that are very simple, okay? And I'm going to ask, first I'm going to ask everybody to participate. Now, you don't have to. You don't have to. But I said I'm going to ask you. I didn't say I'm going to make you, right? Okay. So with this is very simple. This is just a way to get grounded, okay? And just see what this is like for you. Just play with some of these ideas. So I'm just going to ask you to get your right hand, and I'm not going to put it over my heart totally, but lay it on the top of your chest, over your heart. Your right hand, okay? Now take your left hand and just lay it on top of the right hand and interlink the thumbs. So you're interlinking the thumbs. First the right hand, then the left. You're already doing yoga. I'm not kidding. That's yoga right there. Okay. So this is called a hand mudra or gesture. It's a seal, and it's an energy seal. So when you do this, some things are activated as a result of that. Now, that doesn't feel bad, right? So, might feel pretty decent. So you're just doing that. So now what I want to ask you to do while you're doing this, and this is called eagle mudra, by the way, because if you look at me, I guess it looks like an eagle, okay? So you're just laying that on your chest. Okay, here's what I ask you to do, if you want to. If you'd be willing to close your eyes or just have your eyes go down towards the ground just a little bit. Just kind of barely closing them. And here's what I'd like to ask you to do. As you're in this position, just breathing in and breathing out. And just noticing yourself coming into fully the present moment and your breathing. And actually coming into your body. Not being away from it, but actually being in your body. And as you're breathing in and breathing out, here's what I'd like to ask you to do. On the in-breath, I want you to pretend like the air is coming up through your feet, all the way up your body, all the way up to the top of your head. And when it reaches the crown of your head, you exhale and feel it cascade down the front of your body, all the way back out of your feet. So in other words, breathing in, it goes up through your feet, top of the head. Exhale, it goes all the way back down and back out through the feet. And just try that a little bit. Breathing in and breathing out. Now I'd like you to add something to that. As you're breathing in, I'd like you to add the words silently to yourself, saying the words, I am. As you breathe in, I am. On the exhale, I want you to add the word here. So it's, I am here. And then just, with your eyes still closed or averted to the ground, just allow your hands to float down to your lap or your starting position, wherever you began. And I just want you to see what you notice within your body. Any pleasant sensations, any positive energy. And when you're ready, slowly, softly opening your eyes, easily and gently. So becoming aware again of the wisdom of the body. Just within, we're talking about 2 minutes of doing that. What can happen? What can shift as a result of that? So many of our conflicts, physical, yes, but mental, emotional conflicts, we think are out here somewhere, but they're actually in here. And so when we pause and we take care of ourselves in this sort of manner, gosh, And I often forget this my own self. I do it all the time. Oh, I can actually influence this. Gosh, I can actually be kind to myself and, pause, slow down. And that a little bit we say in yoga or mindfulness goes a long way. So I want you just to remember that. And, we may try a couple other things for everybody, but I did want to be able to utilize some of this with other folks up here. So I want to show you a couple of other what we call hand mudras. Again, mudras, it sounds like, gosh, it's some far out thing. But it's just simply ways in which you move your hands or hold your hands along with your breathing that create various states in the body. Physical healing states, calming, energy if you need energy. So I just thought I would show you a couple just so you could file them away a little bit. So first one I want to show you is you just make your fist and you just put them together at about where your solar plexus would be. Now this one is for energy, and this one is called Brahma. You're not going to be tested, but just in case there's somebody there, what's that called? So you just hold that together, and you're just pressing ever so lightly, and you're just breathing in and breathing out. So at home, if you needed energy, or tonight, you need it more, or right now because I'm talking, you needed energy, you could actually do this and just breathe in and breathe out, and you'd start to see your energy go up. Another one is you take your right hand, if you can. If you can't, maybe something else. Your right hand and your left, and it's like you're pulling them apart, okay? And again, at about the level of the solar plexus. So the right hand is in front, okay? I know this is, I teach yoga classes, and sometimes I'm watching them, I'm like, okay, now I'm mixed up, right? Okay, so you're just gently sort of pulling apart, very gently, and just breathing in and breathing out. You just do that for like 2 minutes, and then just see if that gave you more energy. Another one is you would just close your hands together, okay? And then you would just point your index finger up, okay? Now, if you're pointing up, the energy is going to go up in the body. So this is something to remember. This one's called Kali, in case anybody's interested. And you can lift your arms up if you want or not. The higher your arms go, the better in terms of energy shift. But honestly, I've had people sit there for 5 minutes and do this, and they're like, I can't sit here and keep talking. I need to get up and move around. So, just these are ideas that you can play with, which again, so far we have not stood on our head or put our foot behind our head or, stood on one arm or something like that. Here's another one, a simple one. And this one is, how many Girl Scouts were in here? Oh, gosh. Okay. Do you remember this? Okay, remember this? Okay. I was a Boy Scout. It was 3. So with this, you actually hold up both fingers, okay? And with this, you just close your eyes, but you also smile at the same time. I know it seems wild, right? And you would just be like that for like 2 minutes, breathing in like that. Okay, and then you can release it when you're ready. That's called Happy Buddha. Doesn't that seem about right? Now, but here's the thing, like, it's a number of things. One, you're holding the fingers are going up, so energy flows up. But the other thing about it is that you are smiling, so as a result of smiling, it's going to send a message to the body. Oh, hey, we're not depressed. We feel good. So, yeah, okay, right. Yeah, I don't know what happened 5 minutes ago, but we're good to go. Let's work on something, or let's go over here and do this. So it's just little simple things that you can do. Now, does anybody in here? I'm asking this rhetorically. Okay. Does anybody in here have trouble getting so stressed out or so hyper that you need to calm down? Okay. Probably nobody in here, right? Except for me. Okay. Except for me. I am, although I'm a counselor and a yoga teacher, you have to know I am like I said, I'm from a large family. Oldest. I'm a type A person. Any other type A people in here? with that, I mean, it's that constant movement and trying to achieve and doing all like this. And so this has been great medicine for me. Believe me, I'm a believer now, okay, with what it's done. So, but if you needed to calm down, for example, it's very simple. Remember those baby fists? You see babies make this fist. Like you just close your fist, but you have your thumbs in it. And it's very loose, like you're not squeezing it like you're going to punch somebody, but it's just loose. And then you put it down on your lap or you hang it down by your side. You just do that for 2 minutes. Just breathe like that for 2 minutes and see what happens. I want to give you too many and then you're going in so many different directions. But let's say, okay, here's an idea. It may have been emotional. It may have been emotional when you came here today and connected with other like-minded people. And let me tell you why that's so important. A friend and an author and an oncologist, Dr. Jeremy Geffen, you know what he has a quote that he has in his book, and he says, "At the heart of all healing is connection with others. This surpasses chemotherapy," the whole long list of things that he says. Wait a minute, this is a doctor. Are you kidding me? This is a medical doctor that's saying connection with others? Is it the healing? Is it the heart of healing? So, nonetheless, it's okay. And there's, if there's been emotion shared, this is healthy stuff, okay? But let's say that you wanted to kind of bring yourself back in, okay, like your energy, like, yeah, that was good, but I don't know, I just feel too wide open. Or you were going through something emotional. And we've been through some various things in recent times, some recent traumas, and I actually use this for that. With this one, you actually, with the right hand, okay, everybody knows their right and their left, right? But anyway, with the right hand, you just get your index and middle finger to touch the thumb. Then in the other finger, you touch the middle finger and the ring finger with the thumb, okay? So, does that make it easier? Okay, all right. And so all you do with that is you just hold it down and breathe in and breathe out for how long? About 2 minutes. And just see if that shifts or it makes you pull things back in together and feel a little bit better. I want to show you joints. If you were having joint issues, right? You're having joint issues, right? I want to show you one where you can draw energy into the joints, okay? These are so simple. I know you think, somebody would have to think he's making this up. But really, I just ask you, just try it and see if it works for you. So with this one, it's actually called Marma, and there's a whole thing called Marma therapy and all this. But with this one, with the left hand, all you do is touch the middle finger. And in the right hand, you touch the thumb to the ring finger. And you just sit there for the longer you can sit there and breathe with it, the better. The reason I'm saying 2 minutes, that would be like a minimum. But for most people, they're like, oh gosh, he's telling me I got to do this for 12 minutes. I don't have 12 minutes. So, but the longer probably the better. And I'm trying to think if there's anything else that, yeah, if you just bring your thumbs and your fingers together. They actually call this bird's beak. Does that look like a bird, I guess? Anyway, you pull this together like this so that all the fingers are touching the thumb on each hand. Everybody have a bird of some sort? The idea of this is it draws in vital energy. So healing vital energy within the body. If you will email me, I'll be glad to give. You can either sign up for our integrative blog if you want later, or if you give me your email, I'll be glad to give you some reference points to where you can learn more about these sort of ideas. Before we get I guess we better go into the yoga. Okay. All right, so I've got a couple of volunteers. All right. Okay, Ben and Amy. Okay. Hey, Ben. How are you? Pleasure. I am not as dangerous as I appear, okay? And Amy, beautiful. Okay, so I'm going to let's see, what can we do here? So what I was trying to, hi Amy,
Hi.
pleasure. Good to see you. And if you wouldn't mind sitting there, what I'm going to actually, yeah, I think I can take this off. What I'm going to actually do is, I like to do this in a chair because, well, I may be dressed like this, but this is just sort of to say it's for anyone, excuse me, or everyone, but we have to look at what each of you can do. And thank you, by the way, it was very good of both of you to volunteer. What you can do and what you can't. So I'm going to ask, so I'm just going to act like I'm doing a regular, and it'll be a quick session, but I'm just going to do a couple of things here. So, and see what maybe you can take away. So if there's anything that hurts in any way or it causes pain, I want you to stop. If there's something you can't do, it's okay, doesn't matter. I'll help you do something a little bit different. Okay, so just based on what you can do. So what I'm going to ask you to do first is just come to the edge of your seat, but don't fall off the seat. Okay, and we're just going to place our hands on our knees, and we're just going to take in an inhale. And as we exhale, we're just going to lean forward, and we're just going to start rolling in one direction. You can choose whatever direction, just nice and easy, going around in a circle. And actually what we're doing is we're loosening the back, and you can join in if you want, absolutely. So we're just going in a circle, and that's loosening the back and all. So the other thing that it's doing is that it's creating energy, healing energy. So let's take it in the other direction. And you're breathing, just finding a spot where you naturally breathe in and breathe out. Okay, we'll come to a halt. I'm going to make this a little shorter than I normally would because I talked too long on the first part, so I've got to hurry up. Story of my life, right? Okay, so now what we do here is you just, if you can, come down so that your elbows are on your knees or close to that, and then just drop your head. Now, I'm not going to drop my head fully because I'll be yelling into the microphone. And so you're just breathing in and breathing out. And notice that as we do that, as soon as we bend forward like that, what happens in the neck? So we're carrying a lot in the neck. And so this just loosens that and it takes it all the way down the spine. The more we open up the spine, we're going to get a lot of healing energy going along. If you want to, you can stay right there. If you like, you can actually drop down even further so that your hands come between your legs. And the important thing is just keep your head down. Your head stays down. It's just hanging nice and loose. So we would stay like this, about 30 seconds. Now keep your head down, but come back so that your elbows are now on your knees again, keeping your head down. And then hands on the knees, but keep your head down. And then come up very, very slowly, rolling up, kind of like a rag doll till your head comes up. And this is mindful, so I would draw your attention into thinking about what are you experiencing within your body as you're doing this, what you notice. All right, so when we bend forward in any of these, like if I'm standing and I do a forward bend, if you're able to stand and do a forward bend and I bend forward, when I go over, I'm going to kick in the parasympathetic nervous system. So when they just did that, even if you just lean forward some, you're going to initiate the relaxation response. The digestion is going to work a little bit better. So this is something we want to think about when we're doing that. So then just scooting back in your chair, and with the assistance of your hands or not, okay, I'm going to actually mirror you guys, okay? So taking your right foot and seeing if you can cross it, yeah, cowboy style, okay? Sorry, Amy. So, and then just placing the other hand on the knee. And you're not pushing down, but just notice it gives a little bit of pressure there. And you're just breathing in. And we're just sitting up nice and tall, yeah. And now notice what's going on in that hip. So, and again, we would go along a little bit longer. Okay. And then when you're ready, let's just release it down to the floor. Now notice before we even do the other leg, any difference you feel in the two sides, okay? All right, so with the assistance of your hands or not, let's take the other one across. Now, was there a difference in those two sides? Okay. Which one was tighter? Do you mind saying, Amy? Your left? Are you left or right-handed? Okay, all right. Okay. And just seeing what information that gives you. It may be, how your body's structured, what's going on with respect to FSH. It could be various things. Sometimes the dominant side of the body is the side that's tight. Sometimes the left side of the body is considered feminine energy and the right side male. So sometimes if the right side is overworked, like you're too much achieving, doing, and all of that, then the right side can be tighter. Okay, so then releasing it down slowly. And again, just noticing how that feels. Okay, so we're just going to, again, sit just a little bit further forward. And then, again, I'm going to mirror you. But let's just put your left hand down to the side and hold on. We're not going to do much. But let's just see how this feels, okay? So I'm going to ask you to inhale up with your right arm. So just inhaling up with your right arm. Just see however far you can go, it doesn't matter. And then just slowly bend over. Exhale. Inhale up and exhale over. Inhale up and then just release that arm down. And then we would do the same thing to the other side as well. Okay, so, you would do maybe, 3 or 4 repetitions, but you want to think about the breathing. So in yoga, whenever you extend, okay, so like I was extending up, that's when I'm going to inhale. Whenever I contract a muscle, that is when I bend over, that's when I'm going to exhale. Okay, so there's a lot of things actually we can do with all of this. The other thing I'm going to ask you to do is just sit back once again. And we're just going to do a couple more. But just, again, with me mirroring you, pointing your right leg, if you can, just seeing if you can point it. Good. And then see if you can do this a little bit, forward and backwards, circling around if you can. Good. And then just release it down and see if you notice a difference in those two legs and in those two ankle joints. Can go a long way. So let's do the other leg. We're pointing and flexing. So these joints usually don't get flexed that much. And then circling in one direction and in the other. Then releasing it down. And then here, let's just, let's pretend like we're pushing against a wall. Best you can. Yep. However you can do it. Pressing against it. Inhale here. Exhale, come down. Good. Inhale up. Good breathing. Good breathing, guys. Exhale down. Inhale up. Exhale down. And then just let your hands float down. Just notice the wrist joint. So there's more we would do in each part of this, but it's giving you a flavor of what that's like. So let's just do some shoulder rolls to the rear. So you're just rolling as best you can. And we know that the shoulders are affected with FSH, but it's just the idea of what can you do with what you have. So we're meeting ourselves where we are. And then forward if you can a little bit. Okay, and then let's just pause. And here I'm going to ask you, and I'm going to ask anybody that wants to participate in here as we're wrapping this part up too. We're just going to do this yogic breath. And I know that there were specifics about breathing and coughing and other things earlier today, and I don't want to impede on any of this. This is just sort of a different or an additive thing that I'm doing here. And you hear about this like yogic breathing, and there's so many kinds of breathing. But with this, all you would do is actually, you would inhale, and well, actually, if you can place your hand on your stomach, that'd be good. Okay, and just inhale and really fill up your stomach. Inhale, and then exhale. And trying to breathe through your nose if you can, if it's unobstructed. Inhale into the stomach, fill it up, exhale down. And we'll just do one more. Inhale, fill up the stomach, and exhale. Now bring that same hand up to where your diaphragm is or your sternum. So just about right there. And that's what we're going to fill up now. So inhale and fill up that area. Exhale down. Inhale and focus on that area, kind of letting it come out. Exhale down. Inhaling up one more time. And exhale, releasing. And finally, you can have your hand on your chest or not, but we're just going to inhale and really fill up the top of the chest. So inhaling up, and exhaling out. Inhaling up, exhaling down. And just one more good one, inhaling up, exhaling down. So the breathing is the most direct thing that we can control. How many people think they can control their spouse or loved ones? Okay, because I was going to say how many people in here hate themselves, okay, including me. But the idea is that sometimes people will say this to me. They'll say, no, it's not your breathing. It's not, I know something else that I can control even better than my breath. And I say, okay, what? My thoughts? Oh, can you really? Seriously? Because every time I close my eyes, my brain is completely out of control. So I tell you what, close your eyes and don't think about a banana. Right? But our breathing, we really can influence. And the breathing, I promise you, and you know, again, I'm happy to give you various links and all. But if you research this your own self, even if you say, well, Dennis, that's fine and everything, but I can't even get in a chair and do what you're just doing. But you can breathe. Okay, so there's various breathing techniques you can use, and there's also these hand mudras that as well you can use. And they're relatively easy, but again, a little goes a long way. So there's a big impact for just doing a little bit, for dedicating a little bit of time to it. And so the breath, you know, really starts to make a difference in your response. So here's another one. Just throw this in the tool bag in terms of breathing. The next time you get really, really stressed out, hyper about something, really upset, and God, I wish I would have said that, or that person almost ran me off the road. I had to do this literally on the way here. Can you imagine that in Atlanta traffic, that I would have to do that? But the idea is you actually inhale to the count of 3, and you exhale to the count of 3. You continue to inhale to 3, but now you exhale to 4. Inhale to 3, exhale to 5. What am I doing? I'm stretching out the exhale. There's so much that we are holding. We need to exhale. We need to exhale. We've got to push it out of us. Let it out. And so we want to try to extend that exhalation to about 9 or 10. If you can go further than that, that's great. But it's inhale to 3, exhale to 4, and so forth, all the way down. Hope that makes sense. But try that, you know, tonight, the hotel, you're laying down to go to sleep. It's not a bad way to start to relax. 3, 3, 3, 4, 3, 5, 3, all the way to 10 if you can do it. But again, ask yourself, what effect is this having on my body? So thank you so much, guys, for participating. Really appreciate it. Thank you.